All right. Well, thanks for hopping on today to go over our on-demand booking application and go over a brief training. And I'll have all of you, if you can, try to be interactive. There is the website you can go to as well, so you could follow along with me if you're able to. You might have to have a couple screens, but um, anyway. I will go on to the next. So this is our on-demand booking is our quick, easy, seamless way to send in patient referrals. Oh, is it not going here? Advancing. There we go. So with on-demand booking, there's no actual like usernames or passwords. It's basically identifying you as a referring practice because you'll at the very end, either put in your email or cell phone number, and that will send you a code so that we know that you are a legitimate practice that's sending in referrals into Phoenix Children's. So you can use this actually from your computer, your tablet, your cell phone, desktop, whatever you decide to utilize. Of course, mostly at work, but I'm saying, like families could use all of this on their cell phone, and they're oftentimes setting up appointments right on their phone. So if you would like to, while I'm going through this, log into this on-demand booking login page. So that's the website there, book.phoenixchildrens.com. And it should pull up this website in this first page. But I'll kind of walk you through it, and then feel free to ask any questions throughout because each page does just something a little different. So first is the referring practice. So you'll just enter in your practice name and then enter in your email and or your cell phone number. Now, just so that you realize, whoever is entering in the referral is the one that will actually be able to see like all documentation in this application. So I'll show you later, but it says like recent activity. So you as a physician or as, staff member, whatever role you are, you can all utilize this tool. It just depends on, you know, who is actually doing it at the time. I know we have some programs where it's, the physician, it's best for the physician to enter it in because they might ask for specific information, but it's usually the referral team that's entering these in. So at the very end, then again, you'll get a code either via email or cell phone to enter in, and that wraps up the whole referral and will send it then to Phoenix Children's. Any questions on that at all? So hopefully if you're able to log in so you could follow along with me, that'd be great. If not, I can go through just like a little demo at the very end to show you in real time how that works. And then the next page it will take you to is either you're entering in the patient's medical record or first name, last name, date of birth. And you'll see there too, there's little asterisks or little stars. Those fields do need to be, it's required to be filled in. So you do have to put in a gender as well. So last name, first name, date of birth, gender, and of course a cell is always good. They will ask for a cell later on for the family as well. And then you can click on find the patient's name. If they're already in our system, all of their demographics will auto-populate. But if they're a new patient, you will have to enter in some information, not a lot, but just enough so that we have, basic information for the patient. Any questions? Okay, I will go on. Patient information. So then this is the next page that if they're not in our system, that you would have to enter in. So hopefully you can see the slides here. It's a little hard for me to even see. But here it will say, haven't found, patient not found. Would you like to create a new patient record? And then that is where you would go in and enter in all this information. So down below in this orange box. So it'd be first name, last name, date of birth, all of this, address, and definitely they would want email and then phone number to have those listed. Again, they're not required, but, and then you would be able to create the patient. Okay, and then at that time, confirm the patient's email and cell phone number are correct because they will receive a text message from Phoenix Children's after you complete the referral. So all families through this process, and now even through faxing, they'll receive 2 texts and 2 phone calls from Phoenix Children's. So intermittently, but they definitely will receive a text so they're able to schedule right on their phone. Okay, and then this is the appointment request. So this is where we're going into where we're actually in the system and you're sending in the referral. So here is, let's see, I think this is looking at some of the like future appointments. So if this patient pops up, you can see in this that there's some future appointments for this patient that are already scheduled. And then these are the fields that you will fill in. Let me see if it, oh, it does. It goes to the next one. So you can see then reason for the visit. Just make sure you fill that in. You can also pick the urgency, which is normal or urgent. And they do pull those from our system every day. So if there is an urgent need and it's not necessarily done through our connected care center, they will review those. And then there's a timeline, and you can also, and I can show you later in real time, but you can pick a date range that you're looking at. So that's just like a little pull down menu. And then the program or service program, and then the type of appointment. So again, there's a whole pull down menu, drop down menu of all of our different service lines that will pop up, and then the different types. So whether it's a new, a follow-up, again, they'll have some already listed appointment types available for you to choose from. And then you can choose refer only, which is oftentimes, I think, what your referral team will do, or you can find appointments. The find appointments would actually take them to the next spot where they could find an actual appointment and book it or, schedule it for the family. If the family is right in front of you and you want, they want to do that, great. And the time works out, perfect. But mostly you're going to be sending that refer only, and then the family and or patient will decide what time they want for their appointment. And then, oh, this is just another one. I guess I went through that one. It's appointment request. Oh, and this is the find appointment option. So this will show you next what that screen looks like. But again, you have the opportunity or the ability to schedule appointments. Or the nice thing is you can also go into the find appointments to see how far out we are in some divisions, because that will also show you like the next available appointment time that's listed. So I'll show you that. So you can see that here. So an example, what it shows, this is for ophthalmology. So it does show who is available. These are the providers. This is the program service line. Location, what locations they're available at. We're looking at dates, times, and then you could, book that appointment, let's say for September 23rd at Arrowhead at 3. And so you just click that, and then it would go on to the next field. But even just for looking, you could see, oh, wow, they're only out, let's say it's less than a month. At least you have an idea of how far maybe ophthalmology is booking out for appointment times. Any questions on anything? Am I running through it too fast, or pretty good?
Yes, pretty good. Just for if there are any urgent appointments, we are doing provider to provider, and I think sometimes most of the providers are able to do the go around, so to speak. So
Good.
yeah, it's a matter of urgency is also taken care of.
Yeah, the Connected Care Center is probably your best option for those. So I would first send them in the referral so they have all of the information and documentation in our system, and then I would call our connected care center. And they can either do the option 3, which is the urgent appointment line, or option 4 is the peer-to-peer. If you know that that you want them in earlier, I would click that option 3 on the connected care center line, and then that will call our complex scheduling team, and they would be able to take it from there. And they're usually really good about getting those kids in. Generally, it's within a week or two. So great. Okay. And then the refer only, you can see what that looks like. It's you can submit by refer only. So the reason for visit, you're just filling out program service line, program or service type, and then just refer only. There are other things too you could add, if there's preferred days, times, or a provider. Oftentimes, most offices and practices will just leave any time or any provider in there. But if there is someone preferred, it'll have a whole pull down menu. Again, you could choose the provider that you'd like to see. And then this is the next screen that you'll come to. So completing the referral by confirming the demographics. So if it's already auto-populated, the child's already been seen, it will come up with all of this information. But let's say for some reason the insurance has changed, you can change it in here, as well as, let's say, the PCP might have changed. Maybe they're now seeing a different physician. You can change all that information. And then this is where you're going to upload all of the documentation. So if you see this physician order or additional documentation, any one of these, just physical, any again, all the documentation you would need. You're just choosing a file and uploading it from your computer and then saving it in here. There is one spot which I'll have to show you in real time. This more information. You'll also see that there is a box. It's CCA, right? Is that the CCA number?
Yes, the
Yes.
CCA number. I was just going to see where we were placing it.
It will be right below notes. In this picture,
Okay.
it didn't show up. So I need to show you in real time.
Okay.
And I can do it on a test patient, but that's where there's a free field that you would just type in that number on yours.
I have a question.
Oh, is there a question? Sorry.
Yes. So is there a space or an area where we can enter in a secondary insurance?
Good question. There might be. So, I believe there probably is. It just doesn't show it in this screenshot. So once I do the live version, I can try to find that spot, but I'm
Okay.
pretty sure you can put a secondary in there.
Okay, thank you.
Yeah, you're welcome. So once everything's uploaded, again, it needs to be in a PDF format. Then you would just click this book appointment, and then you would enter in your verification code that you receive, whether it's via email or phone, and then that submits the referral to us. So it's actually very simple, very easy. The nice thing is too, you will receive documentation, or you'll see it in the process, be able to see where it is in the process of being scheduled. So I'll show you this next screen. Once you send it, oh, anyway, that's the next screen. Oh, this is the recent activity. That's what I was talking about. So you'll be able to see in recent activity, be able to review the referrals that you have sent to Phoenix Children's. So let me just show you that. So that will bring up all the recent activity once you click that little link. So it's in the upper right-hand corner. And then you can view and verify everything. So you can kind of see, it'll say like patient, clinic type, requested times, and it'll say status, like where it is, like not scheduled, couldn't get an appointment soon enough, or maybe they couldn't reach the family, but they'll have notes in here listed, or it'll say scheduled with, so-and-so physician. I don't know if it says it here, but Those are kind of small for me to read. Anyway, but this is a whole list of recent activity of what you individually have put into the system, so you're able to see what's going on. And then if for some reason as well, like, oh, they were unable to get a hold of the family, you could contact the family, say, hey, they're trying to reach out, please call them to schedule an appointment. That always helps, as well as a follow-up.
So you say it's the person who's entering this information. What about like if let's say Raina entered the information for these patients and Raina's out on an extended leave and we have Jessica following up on hers, she would not be able to see this?
No. Not she would be able to see what she's entered in. The only way that you can is if you use the same email address, which we
Okay.
don't generally recommend.
Yeah, we can't do that.
Yeah.
Share those logins.
Yeah. So that would be the only way. I believe, well, hopefully you have HealthPoint access. In HealthPoint, you could pull up the patient in HealthPoint and at least see activity and see whether or not the patient's appointment was booked or was scheduled. Do you have access to HealthPoint?
I do not, and I think that's what sparked this conversation, is to add additional staff members to is this on demand? And
Yeah,
and
on demand, this is for anyone to use, but the HealthPoint is our patient portal. So that would be additional access to give to those individuals who need it. So it's basically whether it be physicians, MAs, any staff members looking at medical records, radiology, and labs for shared patients at Phoenix Children's. So I definitely would suggest you having several staff members, maybe even physicians, because sometimes somebody ends up in the ER and they want to see, oh, what's happened with that child. So that's the way to get into our system. So does anyone at Gila River have HealthPoint access?
Yeah, most of the providers and the
they do.
RNCCs, yeah.
Okay, good. And
But I don't know if Makaria did Yahtzee and Jessica and I'm not sure who the third one was, but did they have a HealthPoint access?
I believe Jetsy did. Jessica just said she was able to sign in. So Jessica does have access to HealthPoint now. I would just need the other individuals to also be able to log in as well.
Okay. Who should I send that information to? Because it's probably a lead physician and probably you, Dr.
Yes.
DeLassa, to sign off on it.
Yeah, it's me who signs off
Okay.
on them. Thanks.
Okay. Should I just send
Yes.
okay, I will send it to you. Great. And then if you either want to send it to me or to HIM, either way, it's a confidentiality agreement. So basically it's just putting their name, email address, and then you sign off on it. I send that into HIM and then within a week or so, I would think they're pretty quick. They'll be able to give them access. So
So
Yeah.
then at that point, then we'd be able to see whatever Jatsy, because Jatsy's no longer with us, we can go in there and see if those appointments from Jatsy made a month ago.
yes,
Yes.
you would have to pull it up by the patient name. As long as you have all that information, you'd be able to see if it was scheduled or where it is it might not be these kind of notes like this, but it'll say if it was scheduled or not. So if you would need to follow up that, then you would know, like, oh, it looks like it wasn't scheduled, so I need to reach out to the family.
Okay, thank you.
Yeah, you're welcome. Okay, and then that's it. So that's our team, but feel free to reach out to me and with my email address. And I'm sorry, I didn't introduce myself. I'm Maureen Maloney, and I'm the physician liaison for like our Central Valley, Central Territory. Lisa is in our West Valley and Tanya is in the East Valley. So we kind of all intermingle and work together. But if you need any assistance, any one of us can help you. Okay, I'm gonna click out of this and see if I can do a live. And oh gosh, I just realized my battery looks like it's about to die. Okay. All right, so I'm gonna go into an example. Let's see what I can do here. Share my screen again. Okay, can you all see that?
Yes, we can now. Thank you.
Great. So then this is the practice login. So let me see what comes up. There we go. Yellow River. Test site, test patient, but gives you an idea of what. So it looks like, oh, there was an upcoming appointment schedule. Yeah.
Maureen, your volume, something's going on with your volume.
Oh, you can't hear me?
It's just distant.
I just unplugged.
That's better.
Okay, is that better?
Yes.
Yes, you're back. You were completely gone.
Oh, okay. That's not good. All right. Where are we at? All right, so then the reason for visit, I'm just gonna type in what should we write? Heart murmur. And a lot of these do auto-populate too, like you see, so you can like choose which, whatever is going on here. They'll have a list. Normal, urgent, I'm gonna do it as normal. And then again, that's the date. I can pull it out to different dates. You can see this calendar that pops up. Whoops. So you could choose out even further or this month or next week, or so you can choose the time frame that you're looking at. And then you'll see here, this is the whole drop-down list. So these are all of the different programs and services that are available. So we have a lot that the only one that you're unable to send to using this, I believe is the only one, is radiology. In radiology, you would still have to fax those in. So let's go up to cardiology. And then here is it a new patient, or I think there's probably follow-up appointments as well. Yeah, you can see. So we're just going to do new patient. We'll leave it as any provider, but you could see there's a list. You know, these are the, actually, it looks like it's all physician assistants or nurse practitioners for that. And then we can go into find appointments. Let's see what it showed here. So then these are the most current. So look at that. You know, July 20th is the next appointment that's available. So, and then you can see all the lists and then where it's located as well. You can also, if you're just looking for Mercy Gilbert, we can just look at Mercy Gilbert locations or certain dates. Maybe they're only available on a certain date or time. So it's kind of handy. You could use all these different pull down menus depending on, or if there's a certain provider that you're looking for. Again, this is when you're scheduling it, which is probably not often. It's probably, you're going to be pressing that refer only most of the time. So I'm going to go to the refer only and let's see here. More info. Here it is. Here's the CCA referral number. So it's under the more info. And for some reason, all I see is one spot for insurance. So I'm not sure about a second insurance. That's a good one.
I think if you fill it out, they may then open up for the second.
Okay, let's try it.
Yeah.
I don't know if I can. Just making up some number here. I'm going to put your name, Dr. DeLassa. Let's see, it does auto-populate, so you're in our system. Let's see if I can just choose. I'm just going to choose anything. Okay, it's not showing me though. That's strange. So you think that there's a second line there?
There should be in most insurance, fill up forms that I've seen for other providers. Usually a second one pops up if necessary.
Okay. Okay. So maybe that, yeah.
But yeah, if you can check with Phoenix Children's if there is a way to place a secondary insurance on it.
Okay.
I think Raina brought that up because we are having an issue with our patients being called saying that they owe $409 at the time of visit, or because they're not showing a secondary and they're not having us listed as a secondary.
Oh, got it. And part of that too, it's the policy now, and I think I kind of went through this with Dr. DeLassa, but if there's any thought of them being cash pay, it's our requirement to contact them, even though we know that they haven't, they've listed insurance. So hopefully those calls are starting to slow down because I think that they're figuring, the insurance, they're filling that out and realizing that they do have insurance. But are you still receiving those phone calls on that, like asking, for payment up front or asking them what their, if they have insurance?
So it's generally, I think, self-pay, but if they are contracted with us, our PRC is the insurance of last resort, right?
Okay.
If they don't have anything else, or if the other ones don't pick up and they're still contracted with us, they should be able to adjust those payments. But we've got to, it could not just be us, it must be other tribal members too under AIHP that are going through this. So yeah, I'm not sure if there's a way for Phoenix Children's to figure out. I know we are probably the largest amount that are referring to you. And so, but if there's a way to figure out that issue that is going on and overcome it, we would appreciate it.
Yeah.
Yeah, I'm talking to Jessica right now, and she is stating that we're getting a lot of calls requesting the referral information. And even though that it is uploaded on demand, they say that they don't have the referral or they don't have the insurance.
Hmm. Okay. So it's in the system, but it'll say no referral or no insurance?
Correct.
Okay. All right, that is something that I'll have to look into again, because I know that they were trying to, I let them know and they were trying to figure out kind of the best way to resolve.
Also, if they're entering that CCA number, is that number designated solely for Gila River? And so shouldn't that identify that those patients?
No, that CCA is, but it's not for contracted patients, Macaria. It's for AIHP patients.
Okay.
It's for those in access only, is because the contract is between us and Access and Phoenix Children's. But
Oh,
it doesn't identify that, only our practice name in front of it identifies that it's coming from us.
okay. So, and maybe I should ask Jessica. So if the patient has a primary insurance besides American Indian Health Plan, they're not having to enter in that CCA number?
My understanding was anybody under AIHP has to enter the CCA number. We have to enter their CCA number. We have to enter our unique CCA number. It's just one number, right?
Okay. Okay.
Maureen, I'm not sure if you have set up any more CCAs with other communities. I think when I talked to Access, Miss what's her name? Short hair, and I think somebody called Miss Pena, who's in charge of it at Phoenix Children's. To my knowledge, I think Gila River is the only one that right now doing the CCA, but Access is wanting to expand it. So I'm not sure how far they've gotten with it.
To my knowledge, all I know is that your organization is the one that's currently using it, but yeah, but they may have expanded. I don't know that. I can ask
Okay.
though.
Yeah, that would be great.
Expanded. Okay. Great. So hopefully it helps for the walkthrough. Do you want me to walk through another one, or is there any additional questions with this application? It's really very simple to use, and probably your best way versus faxing, because then you do have some documentation you can review and look back on and see, has a patient been scheduled? Where are they in the process? Some other things, just a few other highlights with this. So we are using for faxing, we're using AI bots. So if you do fax, they're feeding those into the system within 4 hours, where it used to take sometimes up to a week. So the faxing has become much more efficient. Let's see. If there's an available appointment after you've entered it in and there's no reason, because in some cases they might need to review the documentation before they actually send out the text message to the family. They might have to review it just to make sure, they're going to the appropriate physician and all of that. But generally, the family will receive a text within 5 minutes to schedule. So very quickly, they'll be able to then either they'll say, we've received your message, your referral, and we'll reach out when we have an appointment available, or they'll be given a text to schedule. And hopefully that's working for your families. If not, they do receive phone calls. So if they're not comfortable with technology, or, it's just for some reason, maybe the texting is just not as simple, we follow up with a phone call.
Maureen, so those text messages, does it specify that they're receiving this text message from PCH?
It should say Phoenix Children somewhere in the text. I know some people think like, oh my gosh, I thought it was spam, and so I deleted it. But I believe the number, it does say it's coming from Phoenix Children's. So
And on the phone calls, does the caller ID specify that it's Phoenix Children's as well?
good question. I hope so, but I don't know if it does. And that's
Just because our patients are very leery of answering phone numbers that they don't know. We see it all the time. And they just won't answer. They'll answer our phone number because they know our phone number, but they don't know other specialty phone numbers coming from other physicians. And that's one of our biggest delays, our biggest challenges is our patients not answering those phone calls that they just don't know. I don't even answer phone calls that have no caller ID.
right. Correct. Yeah. Totally understand that. And that's probably part of the issue, concern with people not answering phones. So they'll just let it go to voicemail, or yeah, they won't pick up the phone. Good question. I'm going to ask our scheduling team and see, because we do have a lot of remote schedulers. So I'm wondering if they're calling in under, one main line that it shows up as Phoenix Children's. I'm not sure.
I know I'm looking at some text messages for my kids with Phoenix Children's, and it does say all the text messages, it's pretty consistent. They put always Phoenix Children's. They might say,
Great.
click here, your doctor has finished. So a lot of updates and always list Phoenix Children's, but
Okay.
you know.
And even just making the families aware, like, hey, just so you know, you'll receive a text message from Phoenix Children's. Look out for it. You can click the link. It's okay.
Yeah. Maureen, I had a question.
Sure.
If we submitted a referral, put the documents in, and then 2 days later we get, we have a new diagnostic that we want to relay to that team, is there a way for us to go back to upload more through on demand, or do we now have to find a fax number to that department to fax?
Yeah, great question. So in that case, I would just fax it to our centralized scheduling fax number, which is the 2436, our centralized fax. And then I would just put like attention, whatever patient it is, or maybe there's additional documentation you forgot to add.
Mm-hmm.
It will get sent to the appropriate division where they will then upload it into the system. So
Okay.
in that case, yeah, I would fax it. But again, just that centralized fax number is fine, as long as like the name and date of birth is attached, because then they put it in our health point system. They'll attach it into the child's chart.
How long has that AI bot been in place? I know it's always been an issue, I think, on our end. When we talk to people at PCH, they can't find it. They can't find it, what we were sending over. I don't know if that's improved that.
I think the AI has helped quite a bit. It's probably been within probably the beginning of the year that they've been using it.
Okay.
So hopefully you're seeing improvements, on your end.
Okay.
I know on our side, for the referral side, some of the information isn't being entered correctly by AI. Well, so the date of birth is incorrect, in the insurance. So we are seeing some challenges with AI and the accuracy.
Yes, that's what they've seen as well. Like, just it doesn't always pull it up accurately. But then that's when, whether it be on check-in or before the appointment, they have them double check and verify the information that's there. And so if they do need to make any changes, they can definitely do it before their appointment to make sure that all the information is accurate. So
And
yeah, it's challenging.
Yeah, and related to, power share, Maureen, I don't know how much insight you have into that. I think that's one thing I've been trying to figure out as well. Like, if we do get those images and we want to send it to the neurologist, we got a brain MRI and, not just the report, but the images themselves. I know orthopedics, my understanding is there has to be a recipient, like a person on the other end of PowerShare, but I don't know a lot about it, but I think that's something to look at.
Yeah, and I don't know a lot about it as well. I felt like it was more for radiology, but it sounds like obviously you're sending it for other. I didn't even think about that, for neurology or other divisions. Um,
Yeah, I think it comes up with probably ortho the most. I know RER, I think they have figured it out for those orthopedic cases, or I mean any image, but I don't know. For us at outpatient, I think we do that at times, and it's needed. Or like you said, a secondary read by your radiologist. That would be a good scenario.
do you have access to PowerShare?
I personally do not.
Okay, do you know
I'm
if
not
anyone on the
sure.
team does? Because if not, obviously that would be something that would be important to have.
Yeah, I'm not sure if it's just imaging or HIM. I'm not sure actually.
I'm not sure if anyone on PRC has PowerShare as well.
No, no,
I believe him does, and then Amy, correct me if I'm wrong.
I do not. So
No, it, just hear me out. How is the Echo one going to PCH? It is going on PowerShare. So is it
that's for
PCH
medical
person?
imaging.
Yeah. But is it the tech that is doing it, or is it the our radiology team that's doing it?
I think we would have to follow up on that, but I believe it's through our system. But I think that's why we're sending it over to medical imaging. So I would say HIMS and medical imaging have access to it.
Sounds good. Yeah, I think it would improve if we figure out exactly how it works. It'll help with referrals at times as well. I just want to bring that up. Thanks.
Can you hear me? Okay.
Yes.
Okay.
And just on the PowerShare, if we can get the HIMS record release and from a patient so that we are able to PowerShare with the ongoing. So that might be another thing we can just keep in the clinic so that we can then include everything for sending out to Phoenix Children's.
Okay, so record release form, is that what that is?
Yeah, yeah. We do have it on our end, but if there's something different on your end, please let us know.
Okay, okay. What was the other? I was going to discuss with you wait list. So any one of your patients is also able to opt into the wait list. So let's say, for example, some of those divisions are out quite a ways, or they would like to get in sooner in the app. So like once they receive the text message, they can go in there and opt, or even just let the scheduler know that they'd like to be on the wait list. And they have appointments available for both new and follow-up appointments. So what ends up happening is there is a text that's sent out to 5 patients, and then they get that one time slot to book, basically. So the first one to get to it, and then it kind of goes to the next list and the next list. So it is a way to get in quicker, especially for some of those divisions that are out, for access. They're out a little further. And then what else? Let's see. And just so you're aware as well, any referral that is sent in, it does remain in our system for a year. So if they don't decide to schedule right away, want to postpone it till later, for whatever reason, that referral is always sitting in our system up to 1 year.
Maureen, how quickly do they transition into archive? I've heard some of the ladies say that when they call to check in to do like a follow-up to see if the appointment has been made, it says there's no referral on file, there's no information on file. And then they'll tell them it's here on, like they did it on demand. Then the scheduler usually says, oh, it was in archive.
That's a great question. Okay. I will ask on that. I have a whole list of questions here. So Dr. DeLassa, should I just follow up with you with these questions?
Yes, that would be great. And then if we do need to just do a second meeting, that would be fine too.
Okay, happy to do that.
I believe after the third call is when they send them to archive.
Okay. And maybe that's it. So it's like the 2 texts and the 2 phone calls or 3 phone calls, whatever it happens to be. And then they might just put it off in, off on the side. It's not, it's still, again, still in our system and they can find it. But yeah, that's a great question. And then we're encouraging, I know even the scheduling teams encouraging families to use the patient portal. Again, I'm not sure how easy that is to navigate. Maybe some of you have young children, have used it. They have updated it fairly recently, but you can change appointments, request appointments. They can send messages to our physicians all in that portal as well. So they're saying, very useful and convenient for families to utilize. So even just letting them know about the portal and to sign up for that use.
Yeah, I've heard pretty positive reviews, Maureen,
Good.
from my patients and also
Good.
from personal use.
Great, that's good to know. Good feedback. Any other questions? I tried to get someone from our scheduling team on and she was busy at this time. But definitely she said, let me know if you have any questions, happy to respond. So I can always try to work a different time, work out a different time that she's available to come. And, if you have specific questions you want to throw at her, she's happy to attend. So
sounds good. Just and upfront with you, we too have sort of just rolled out our scheduling portal, I guess, program, so to speak. Most of our kids, kids' parents enjoy it. It's been going fairly well. So hopefully, even having PCH doing the same thing actually has a domino effect into our space too.
And you said you have your own portal.
Yes.
Oh,
yes.
wonderful. Okay,
Yep.
Great, good. I'm glad that's working well. Any other questions for me or anything that would be helpful?
I think it might be a matter of just us going for the new people on this to go through it for a few times. And just to let you know, Maureen, for us, all the referrals tend to go through our purchase referred care, PRC, so to speak. And then they get uploaded by the scheduler at PRC. After their benefits have been made sure that they are eligible to do that, etc. Sometimes we have just different payers which are private, and so we will have them do it the other way. But for most AIHP patients and for most of patients that are contracted to us, it does go through our purchase referred care for scheduling. The one time it doesn't is when I'm calling to see, after I've verified all the benefits, to see if it's an urgent case and I need to send it down, irregardless, then it does go from provider to provider.
Got it. Okay. And so I'm assuming those on the team that are doing it from PRC are on this call, so they.
Yes. And and I forgot to introduce, but Makaria Greco is our manager for PRC. She's the lead on there. We have, I'm not sure if Reina was on it, but Reina too is from PRC. Jessica Salazar is from PRC. Casey Mesa is from PRC. And you can see some of the others. Michelle Albrecht is from our care management team, and Erica Kalis is from our care management team. Just, kind of who do we do the pass off to as from a provider to an RNCC, and then it goes down to PRC, etc. And Scott McCrimmon is our IT director. just kind of learning some of the byways for how we are doing it with Phoenix Children's.
Great. Well, very nice to meet with all of you. You have my email address, so if something comes up, feel free to reach out or call, text. Happy to help or assist if things, any concerns or challenges come up that I'm not in this system every day. I know probably you as staff are. I mean, I've utilize it and have done the training on it, but if you're in it every day, you learn all the tips and tricks and kind of making it, ways to streamline. But it's a great system that
Right.
actually our internal system built. So, and yeah,
Yes. I think I have one big question, and I think Makaria alluded to it earlier. So Yahtzee Bagnall used to do most of our referrals from pediatrics. Is there a way to run a report from your side? Because we are not able to see the on-demand for her specifically, and we can start from there, what we look into the health point for, and just, make sure that we didn't have any gaps when she had put the referrals in.
that is something I can ask our scheduling team. Let's see if
Okay, great.
they can run.
Okay.
And it would probably just be, I'm assuming just from her email.
Yes, from her email. Yeah, just designate from her email. Yes.
Yeah. Let me see if they can do that.
And Makaria, how far back would you want it? 6 months, what, or 1 year?
I would say 1 year just in case,
Okay.
because
So
we do have those developmental ones that are, some
Yeah,
can be a
okay.
year old. Yeah.
Yeah.
Okay. Yeah.
I have a question too, and I don't know if you can answer, but at what point, like if the parent tells us, because we've got those notifications that they've contacted the parent 2 times, 3 times, 2 calls, the 2 texts have went out. We also send a pending appointment letter stating your referral has been sent to PCH with this for this specialty. Here's the phone number, reach out. But if those parents are still not engaging with Phoenix Children and they reach out to us and saying, can you just do it? Can you make the appointment? Is there an exception for that, or how can we go about that? Because we do have parents or grandparents that don't know how to navigate the scheduling system, they just don't feel comfortable, and they rely on PRC majority of the time for us to make those appointments for them. I feel like this is a big hindrance because we do need the parents involved, but if they're not scheduling and they're not making that contact, I just don't want to delay the care even further. Obviously, there's a need for them to be referred out to your facility. And I just want to make sure how we can assist those parents, those grandparents in scheduling.
I think the on-demand, you can do the appointments.
Yep.
That's
all
the,
the specialties.
yes.
Yep.
Most of the specialties, yes.
Yeah, you could schedule them for the family. So if you have them on the phone or they're right in person, and you're like, these are the appointments that are available. I guess not all of them, because some they do, again, they review the notes. But after they're reviewed and once they, are able to be scheduled, you can call on their behalf as well. So call, or even through the on-demand system, and you can choose the appointment times for them. And then of course, then reminding them, of the appointment time as well. But yeah, definitely that's something that you could do on your end. I know it's an extra step. It's, more work on your plate, but
which we don't mind as long as we're able to, and maybe it was just miscommunicated because like Jatsy would say, well, I sent it, they're not scheduling, and she would just leave it at that. She wouldn't take that extra step to saying, hey, let's call to see. I know Manuela on our west end, she would call and saying, hey, let's just schedule this. So she was able to do that some of the times. But like I said, it was just a miscommunicated with Jatsy that it wasn't an option, but I'm glad that you're clarifying it is an option that we can assist them.
Yeah, yes, definitely. Yeah,
Thank you.
I'm sure, like, just like you were saying, some families it's a little more difficult. They're not able to navigate the system. It's challenging or overwhelming. That's definitely something you could do on your end. So,
Thank you.
yeah, you're welcome. Any other questions or comments? All right. Would it be helpful to at some point have someone from our scheduling team attend a meeting, maybe even just like a 30-minute, just for, question and answer session?
Yes, I think maybe in 7 to 10 days, once the next team has, make themselves understood on that program. And if I can get the ones that Yahtzee had under her belt from the emails, then we can kind of see if we do need some more help, and where we are noticing the new gaps from our end.
Okay. Okay.
Maybe not 4th of July week. I guess maybe the week after that would be
week
a
after.
better,
Okay.
because I think we're extremely short-staffed everywhere next week. So
Okay. Yeah.
this being a
lot of
short
people
week.
are out. Yeah, for sure. So maybe the second week. Okay.
Yes, that would be great. Thank you.
Okay. All right, great. Well, thank you all for your time. I really appreciate it. And again, feel free to reach out with any questions. I have a list of questions I need to follow up on. So I will get back to Dr. DeLassa and let you know what I find out.
Thank you. Thank you,
right.
Maureen, as
Yeah,
always. Thank you.
Thank you. Have a wonderful afternoon. Thanks.
You
Thank you
too.
so much.
You
Thank
too.
you. Thank you.
Bye-bye.